Good day, ladies and gentlemen, and welcome to You and Your Health, where we dive deep into the world of healthcare. I'm your host, Alexis Burrows, and today we have a highly informative and potentially life-changing episode for you. September is Prostate Cancer Awareness Month, and what better way to wrap it up than with an interview with a leading expert in the field. We're about to embark on a journey through the intricacies of prostate cancer, early detection, and a groundbreaking treatment option known as brachytherapy. Our guest today is a renowned urologist with a wealth of knowledge and experience in this field, and I promise you, by the end of this episode, you'll have a newfound understanding of the importance of prostate health. So whether you're a man concerned about your prostate health, a woman supporting the men in your life, or simply someone looking to stay informed about critical health matters, you're in the right place. This is You and Your Health.
You and Your Health is brought to you by Doctors Hospital Health System.
Welcome to You and Your Health, everyone. I'm your guest host, Alexis Burrows, Marketing Director at Doctors Hospital. Here with me to talk about prostate cancer and screening and brachytherapy today is urologist Dr. Greggory Pinto. Welcome to the show, Dr. Pinto.
Thank you very much for having me. It's a pleasure to be here, Alex.
We are happy to have you on the show today to talk about prostate cancer, the importance of testing, and the launch of a new treatment to Doctors Hospital and the Bahamas. But let's start at the beginning. Can you provide an overview of prostate cancer, its prevalence, and why it's important for men to be aware of it?
Prostate cancer is an inevitable part of growing older. If a man reaches the age of 90% of men at that age would have some element of prostate cancer. So the number one risk factor for prostate cancer is advancing age. Most men in this country are going to be afflicted with prostate cancer at the age of 66 to 68. So it's a disease of older gentlemen. Mm-hmm. Another very strong risk factor, unfortunately, is being of African ancestry, which is a predominant feature of our society. So when you have those two high risk factors, we're living longer. That's great news. But because of our African ancestry, we are at high risk of not only developing prostate cancer at a higher incidence than our other racial counterparts, but actually a more aggressive form of the disease. It's almost a different entity when you talk about a Caucasian's prostate cancer and that of a man of African or Caribbean ancestry. So we need to be very diligent in picking up prostate cancer early. And the good news about prostate cancer, although it has a very high incidence, it's the number one cancer in this country, as many as 1 in 6 men are going to be afflicted with prostate cancer in their lifetime. If we can pick it up early, when it's organ confined, when it's low risk, the chance of survival at 10 years is 100%. Very few cancers you can say that. So taking out the big myth that prostate cancer is a death sentence is actually the opposite of that. And there's so many ways that we can treat prostate cancer, including brachytherapy, which I will get into, that is minimally invasive, outpatient, so you don't even necessarily need surgery. There's little or no recovery. So prostate cancer is something that if we can pick it up early, and surveillance is the key to that, getting a prostate-specific antigen every year from the age of 40 going all the way to the age of 75, if we can pick it up early, your chance of cure is nearly 100%.
You mentioned two particular risk factors associated with prostate cancer. Are there any common misconceptions about these risk factors that you want to dispel?
There are other risk factors as well, and that also strikes many Bahamian men, unfortunately, because our lifestyle, our unhealthy lifestyle. Obesity is not going to cause prostate cancer, but if you do develop prostate cancer, if you're an obese, you're at greater risk of developing a more aggressive form of prostate cancer. If another example is if you have a high alcohol intake, particularly in middle age, that can also cause you to be predisposed to a more aggressive form of prostate cancer. We have a lot of gene mutations, unfortunately, in our society. We talk about breast cancer gene mutation, type 1 and type 2, which can be inherited by men and women. There's a misconception regarding that as well. And men can also get breast cancer. So if you have a BRCA gene type 1 mutation, your chance of getting prostate cancer in your lifetime is 3.6 times greater than if you don't. If you have the type 2 mutation, your chance of getting prostate cancer by the time you're 70 is 8.6 times greater than if you don't. So that's where in certain families where there's a high incidence of breast cancer, of pancreatic cancer, of prostate cancer, it's always a good idea to actually do genetic testing so that we can pinpoint those patients who are very, very high risk or almost inevitably are going to develop prostate cancer. So we can screen them every 6 months so that we know that when they do almost inevitably develop prostate cancer, we can treat it and give them an excellent cure rate. And prostate cancer is just a small little bump on the road that we've overcome, and they can live their life, a normal, long life, and happy life.
So you mentioned screening and testing, and prostate-specific antigen testing has been a topic of discussion in recent years. Can you explain what PSA is and how it's used in the screening process?
So PSA is not specific for prostate cancer. It's specific to the prostate gland. Okay. It's an enzyme, prostate-specific antigen enzyme. It's an enzyme produced by the prostate epithelial cells. It's not a very sensitive or specific test if you're just looking at prostate cancer, but it's an excellent first-line screening tool. So if you have inflammation of your prostate, if you have an infection of your prostate in the form of prostatitis, if you have a very big but normal prostate, your PSA is going to be higher than average. If you're not emptying your bladder, your PSA could be higher than average. So we use that as first-line screening, then we do more specific tests, including PSA-related tests. We can do a PSA velocity, looking at the change over time. PSA, what was the PSA last year? What is the PSA this year? Has there been a large change over time? That might be an indication of prostate cancer. We look at PSA density. The larger your prostate, even in terms of a normal, non-cancerous prostate, can contribute to your PSA being a little bit elevated. So then we look at, for each gram of prostate, how much of that contributes to your PSA, and that's the form of PSA density. There are other screening tools, 4K score, there's a prostate health index score, there's a urine RNA test, there are a whole multitude of genetic testing that we can do. But first line screening, the easiest test, the least inexpensive, the one we get the biggest bang for our buck, is a PSA test. But just because you have a elevated PSA doesn't mean you have prostate cancer. Just because you have a normal PSA doesn't mean you don't have prostate cancer. So it's always very important that you get your PSA every single year from the age of 40 to 75.
Okay. Is there anything in particular that men should consider when deciding whether to get screened or not?
If you have a very strong family history, if you have first-degree relatives or even more than one first-degree relative who's diagnosed with prostate cancer under the age of 50, we want to start prostate screening at 35. If you have had genetic testing, you've found to have a genetic mutation, including breast cancer gene mutation, again, we'd want to start screening you at 35. We can even, in certain individuals, consider screening you every 6 months because we want to be very diligent and on top of whether you develop prostate cancer so that when we can treat it, we can give you a 100% cure.
Okay. Understood. And obviously there are different screening methods for prostate cancer. One we've already talked about, which is the PSA test, and another that I think most men probably have some trepidation about is the digital rectal exam. Can you explain the differences between these methods and their importance in early detection?
So there has been a lot of debate over the last 20 years in particular related to digital rectal exam. Does it really provide any benefit in terms of first-line screening? And I'll look at the guidelines for the American Urology Association, AUA, which all urologists follow. Or if you're in Europe, we'll follow the European Association of Urology guidelines. They both specify that for first-line screening, the digital rectal exam provides little or no benefit. In fact, in our society, where there are homophobic connotations, it actually does more harm than good. So we're asking a 40-year-old who has very little risk factors for prostate cancer. We basically want to get a baseline PSA and then get them to get PSA screening every year. We're just going to turn them off from ever coming again in their lifetime, or maybe not for the next 10 years, because we gave them the dreaded digital rectal exam. There's also a misconception even within the medical community amongst physicians. If you have a normal feeling digital rectal exam, it doesn't mean you don't have prostate cancer. Right. In fact, we're trying to pick up prostate cancer where on digital rectal exam, the prostate can feel completely normal. So there's a lot of misconceptions. The digital rectal exam is not advocated for first-line screening. It can have a role in later in terms of staging, et cetera, in terms of surveillance if you are you diagnosed with very indolent low-risk disease, and we're just going to follow you until there's an upstaging of the disease and when it's the time to cure you. But in terms of doing routine screening, digital rectal exam really has little or no benefit.
Okay. Dr. Pinto, we have to take a quick break, but we have a lot more to talk about. You're watching You and Your Health. We'll be right back.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
The 17th Exuma Business Outlook is coming up Thursday, October 19th at Sandals Emerald Bay. Join us as we discuss the theme Forward, Upward, Onward Together in celebration of the nation's 50th anniversary of independence. Keynote speaker, the Honorable I. Chester Cooper, Deputy Prime Minister and Minister of Tourism, Investments and Aviation, will be joined by a diverse slate of speakers. Don't miss this valuable networking opportunity. Register now at tclevents.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome back to You and Your Health. If you're just tuning in, I'm Alexis Burrows, Marketing Director at Doctors Hospital, and today's guest host. On today's show, we are talking about prostate cancer and brachytherapy with urologist Dr. Greggory Pinto. Before the break, we discussed prostate screening options for men. But now I want to shift gears to talk about treatment and the upcoming launch of brachytherapy at Doctors Hospital. So Dr. Pinto, can you describe what brachytherapy is and how it's used in the treatment of prostate cancer?
So brachytherapy has been around for a century in one form or the other. In the last 35 years, it's been one of the #1 treatments for prostate cancer, particularly in Europe, in Canada, United Kingdom. It's also widely available in North America. The benefit of brachytherapy for prostate cancer is it's an outpatient, minimally invasive procedure with little to no recovery. It has cancer-specific survival equal to, or even in many long-term studies, superior to the Da Vinci robotic prostatectomy. So it has an excellent cure rate in long-term. It is available for, there really are very few patients who have a contraindication for brachytherapy. You can provide it for low risk, intermediate risk, or even high risk prostate cancer. So if someone is at high risk with a very aggressive form of the disease, we're going to offer them not just one form of therapy anywhere. We're going to give them trimodal therapy. We'll give them external beam radiation. We'll give them brachytherapy, which is called boost therapy. And then we're going to provide them with androgen deprivation therapy for 1 to 3 years. And that will provide an excellent cure rate for someone who has a very aggressive form of prostate cancer. For low-risk prostate cancer, it's an excellent treatment modality, particularly for patients, and I have dozens and dozens of patients in this country personally who are on active surveillance. We pick up the prostate cancer where it's so low volume, so early, the disease is basically indolent, of no clinical, it cannot cause any harm to the patient, essentially, in layman's terms. We can watch you for many years, 5 years, 8 years, 10 years, 12 years, very carefully, and then when there's any upstaging of the disease, we can offer you the excellent treatment modality of brachytherapy. Another great advantage of brachytherapy is in terms of all treatment modalities for prostate cancer, and there are many, it has the least side effect profile. So you're going to keep your erections, which I know Bahamian men are going to love to hear, at the highest rate when you compare to any other prostate cancer treatment modality. In fact, many studies have looked at as high as 94% chance of maintaining excellent erections after brachytherapy.
So that sounds like an excellent treatment option, Dr. Pinto. Are there any specific criteria or factors that make a patient an ideal candidate for brachytherapy as a treatment option?
So for any patient, if you're going to offer them curative prostate cancer treatment, you want to have a patient with an expected life expectancy of greater than 5 years, because if you're bedridden with a stroke, if you have ischemic heart disease, and because of your other comorbidities, you're unlikely to die of prostate cancer. You're more likely to die of another comorbidity. So life expectancy is really one criteria. The other one is in terms of if you have low risk, intermediate risk, or high risk, brachytherapy can be a part of all of those in terms of stratification of the disease. You can even have brachytherapy as part of salvage therapy, where someone has had another treatment modality for prostate cancer and they've had a recurrence. So brachytherapy can be used for prostate cancer management along the entire spectrum: very early disease, intermediate disease, and a high risk or aggressive disease, and recurrence of prostate cancer as well. One of the other criteria is in terms of the size of the prostate itself. Ideally, for very, very large prostates, so a normal sized prostate is 20 grams or less. Ideally, you want to have the prostate gland no more than 60 grams, ideally no more than 50 grams. So if you have a 120 gram prostate, if you have a 150 gram prostate, we can offer other treatment modalities to reduce the size of your prostate to make it the ideal size before we offer you brachytherapy. And that can be done minimally invasively as well as an outpatient. We're also, before the end of the year, at Doctor's Hospital offering, for the first time in the Commonwealth of the Bahamas, as well as brachytherapy, green light laser vaporization for obstructive prostate, whether that's benign disease or whether that's for patients with prostate cancer, trying to reduce the size of the prostate for reducing urinary symptoms, or in the case of brachytherapy, making the size of the prostate ideal so that we can offer brachytherapy as an excellent treatment modality.
Awesome. So you mentioned that this is an outpatient procedure. A patient can be in and out within 45 minutes. Are there any other aspects of the process that you'd want to let people know what to expect as they prepare, or they're considering undergoing brachytherapy?
So you're not going to feel a thing. And all the men are also very wary of pain. You're going to have some form of anesthesia, whether that's general anesthesia or spinal anesthesia, where essentially you're numb from the waist down. We let you listen to some music. You're breathing for yourself. You're in a arousable state of slumber, where you're basically in and out of sleep, but we can wake you up and talk to you. You can enjoy your favorite music, and before you know it, it's all done. So even when we have general anesthesia, the most common, and most of modern urology, everything I do is minimally invasive for the most part. Everything, 95% of what I do is outpatient. The most common thing after the procedure is done, a patient will ask is, I just feel like I had the best sleep of my life. When are we going to start? And I'm going to say, as soon as you're more awake, you're good to go, and they don't believe even anything's happened. So that's what is the advantage of minimally invasive. Right. So I don't want patients to have that fear that there's recovery. I don't want to have the fear that it's going to affect their erections, or the fear that there's going to have any pain, or the fear that there's not going to be any anonymity. You're going to get all of that available. It's the perfect solution to a condition that is a burden on our healthcare system. There are far too many men in this country dying needlessly of prostate cancer, when prostate cancer is probably the easiest cancer to treat, with the excellent cancer survival, specific survival. And if we can do this minimally invasively, where a patient doesn't have to go into hospital, where there's no recovery, and keep your erection, that's the dream come true for a Bahamian man.
Okay. I'm not going to put words in your mouth, but it sounds like there's little to no side effects or complications associated with brachytherapy. Can you elaborate on that at all?
So it's a form of internal radiation, where you place low-dose radioactive seeds that disperse low-dose radiation, only a few millimeters in either direction of the seeds themselves. In fact, if you look at my fingertip, you can place several seeds just on my fingertip. That's how small they are. Okay. So essentially, as I said, there's no cutting. We use small little needles to deliver the seeds strategically. So the only issues that you may have afterwards, you might have a little minor numbness in the perineum, which, as I said, is the area between underneath the scrotum and above the anus. You might take Advil or Tylenol. There's no extreme pain. You're up and about. You can drive. There's no limitation in your activity other than we advise you not to lift anything heavy. Another advice is take it easy, keep sex post-op aside for at least 2 weeks.
Okay.
But you can go back to work immediately depending on what type of work. There's little or no to recovery, as I said. I've known patients many times, we do it in the morning, they're going to dinner, celebrating their survival from prostate cancer with their wife that night. And people will see them out enjoying themselves and don't even know anything happened.
Right, understood. This is great information so far, and I hope you're enjoying this discussion at home as much as I am. We will continue our conversation with Dr. Pinto when we return. This is You and Your Health. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
The 17th Exuma Business Outlook is coming up Thursday, October 19th at Sandals Emerald Bay. Join us as we discuss the theme Forward, Upward, Onward Together in celebration of the nation's 50th anniversary of independence. Keynote speaker, the Honorable I. Chester Cooper, Deputy Prime Minister and Minister of Tourism, Investments and Aviation, will be joined by a diverse slate of speakers. Don't miss this valuable networking opportunity. Register now at tclevents.com.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Health. I'm Alexis Burrows, today's guest host. Our guest, urologist Dr. Greggory Pinto, is still here, and we're wrapping up our discussion around prostate cancer awareness and brachytherapy. So far, we've discussed prostate screening and brachytherapy, but as we put a bow on our conversation, Dr. Pinto, I'd like to ask you a few general questions around the area of prostate cancer. So in terms of prostate cancer awareness, what advice do you have for men in terms of regular checkups, screenings, and maintaining their prostate health?
So for prostate cancer, you want to be able to have a healthy lifestyle. Before, that's just part of general good health. You want to have exercise at least 3 times a week. If you want to stick with that exercise, do something you love, do it in groups so other persons are going to be encouraged to participate with you. Healthy living is also important in terms of for prostate cancer. And healthy lifestyles. You don't want to smoke. Cigarette smoking, cigar smoking is going to increase your risk of all cancers, including prostate cancer. You want to have healthy sexual practices. If you are going to be struck with sexually transmitted disease such as HPV, human papillomavirus, that can increase your risk of getting prostate cancer. You exposed to chlamydia, gonorrhea, syphilis, that will also increase your risk of getting prostate cancer. So healthy living is also very important for prostate cancer. You want to reduce your red meat intake. You want to make sure that you eat healthy. You want to have a well-balanced diet. That will also reduce your chance of getting prostate cancer. But know your family history. If you have a strong family history of prostate cancer, you have to be more diligent.
Now you mentioned brachytherapy and another new treatment modality, but are there any other recent developments or advancements in either detection or treatment of prostate cancer that you find particularly exciting or promising?
So very promising is the use of genetic testing in terms of stratifying who in our population is at higher risk of developing not just prostate cancer, but a more aggressive form of prostate cancer. So even in terms of doing prostate biopsies, we wanted to do genetic testing on those biopsy tissues to determine and stratify these patients as to who's at higher risk of developing a recurrence, even if we cure you. So just because you're cured of prostate cancer, in the past we didn't understand why would someone 20 years later get a recurrence and someone 30 years later had no recurrence. So we can actually do genetic testing on the tissue that we get from biopsy, or even if we do the radical prostatectomy and remove the entire prostate gland, we can do genetic testing, and that can give us a risk stratification. In the next 10 years, this particular survivor of prostate cancer has a 3% chance of getting a recurrence. This particular prostate cancer patient has an 81% chance of getting recurrence of prostate cancer in 10 years. So for those patients, we need to treat them in terms of post-operative curative period differently than someone who has little to no risk of recurrence. There's also a lot of research in terms of they've determined that there are 5 types of anaerobic bacteria, which are bacteria organisms that can thrive without any oxygen, proliferate and progress and grow without any oxygen. And they found a strong link between that bacteria in the urinary tract system and the incidence of prostate cancer. So the hope is we can confirm this within the next several years and actually treat patients for this bacteria to make sure that we can lower the incidence of getting prostate cancer in the future. So the future is bright in terms of prostate cancer and in terms of modern urology.
Now, what can individuals and organizations do to help promote prostate cancer awareness and encourage men to take proactive steps in their prostate health?
Fear. Fear is the number one culprit for men in this Commonwealth of the Bahamas seeking even primary care, annual surveillance for all the comorbidities, whether it's diabetes, hypertension, hypercholesterolemia, heart disease, colon cancer, prostate cancer. So we need to take the fear out of it. Okay. Number one, in terms of prostate cancer, as we mentioned, let's talk about the elephant in the room, digital rectal exam. Men are going to be put off and procrastinate and delay and possibly never get prostate cancer screening because they're fear of the homophobic connotations, the invasive nature of a digital rectal exam. And I'm here to say, for first-line screening, for a typical Bahamian man, there's no role for the digital rectal exam. All we need is baseline PSA screening.
So just any final key takeaways you want our audience at home to remember about prostate awareness, testing, and the role of brachytherapy before we wrap up?
Prostate cancer is the number one cancer in this country, even superseding the numbers of breast cancer that unfortunately we are plagued with in the Commonwealth of the Bahamas. As many as 1 in 6 men are going to get prostate cancer, and because we're primarily of African ancestry, we're unfortunately going to get a more aggressive form of the disease than our other racial counterparts. So as I mentioned, it's almost a different disease entity. So we need to be very diligent. We need to make sure that we pick up this prostate cancer when it's organ confined, when it's low risk or even intermediate risk, so we can provide a 100% cure rate. Brachytherapy is groundbreaking and is going to transform the way not only we think of prostate cancer in this country, but the way we treat prostate cancer, because it can be done as an outpatient with all the anonymity in the world, with little to no recovery, where the most important thing for men is not going to affect my quality of life. We look for the trifecta. We want to cure your prostate cancer so it never comes back. We make sure that it doesn't affect you in terms of having urinary symptoms, and we want to make sure that you maintain the same erections before and after the treatment. And for brachytherapy, long-term studies throughout the world have shown conclusively that it has one of the best cure rates of any treatment modality, and it has, without a shadow of a doubt, the least side effects of any other treatment modality.
Okay. All right, thank you so much, Dr. Pinto, for taking time out of your schedule today to join us for You and Your Health and for the in-depth conversation and information.
It's my pleasure.
For our viewing audience, if you are a man over 40, you still have an opportunity to get a discounted PSA test to get your early screening done. So you can visit Doctor's Hospital at our lab, any of our lab locations. We have a special running right now for $30 for a PSA test. So be sure and get your screening done early. It has been a pleasure hosting today's show. Don't forget to follow You and Your Money on social media and tune in next week for another exciting show. Thanks for watching.